So that is the complication. Bleeding inside the vitreous, it is one of the complications that is known as vitreous hemorrhage. How vitreous hemorrhage occurs? From the abnormally grown new blood vessels. Now, the pathophysiology of diabetic retinopathy, I told you the microaneurysm. Microaneurysm is the first sign. When there is leakage from the capillaries, hard exudates, RBC and fluid. These things are leaked. And some part of the retina is anoxic because that part of the retina is not getting sufficient blood supply. So that anoxic part, it makes this white cotton wool spot, that is anoxic retina. So anoxic retina, what happens? It triggers a vascular endothelial growth factor. Due to the anoxia of the retina is not getting proper blood supply. Some part of the retina not getting proper blood supply. So it triggers a vascular endothelial growth factor, VEGF. Now, because of this VEGF, some abnormal blood vessels are grown in the retina. And when these blood vessels bleed, these are fragile blood vessels. These are not normal blood vessels. These are fragile, abnormal, newly grown vessels in the retina or vitreous. Now, when these fragile vessels bleed, they cause vitreous hemorrhage. And that time vision will be deteriorating very suddenly. As such, the vision loss is not sudden, but in case of vitreous hemorrhage, what happens? Vision loss is very sudden. The moment there is vitreous hemorrhage, the media becomes opaque. So what happens? The vision deteriorates suddenly. So this is the complication. Vitreous hemorrhage is a complication of diabetic retinopathy. Another complication is glaucoma. How this glaucoma happens in case of diabetic retinopathy? In long-standing vitreous hemorrhage, the volume of the eye increases and it causes glaucoma. Another cause of glaucoma is this new vessels which is formed in the retina. Because of this VEGF, vascular endothelial growth factor, this is triggered by anoxic retina. So this factor, it causes formation of new vessels in the retina as well as in iris and angle of anterior chamber. So in there, if the new blood vessels, it clogs the trabecular meshwork and it causes glaucoma. So the glaucoma is caused by two mechanisms in diabetic retinopathy. One is long-standing vitreous, it is causing the volume increase in the eye. Second, it is clogging the trabecular meshwork by the newly formed blood vessels because of this vascular endothelial growth factor. Right? Now, another complication is retinal detachment. How it happens? It happens by the traction from those abnormally grown fibrovascular tissues. This is the advanced stage. This complication, it occurs in advanced stage, not in early stage. So in advanced cases, what happens? These newly grown vessels, because of this vascular endothelial growth factor, newly grown vessels, either they will bleed because of their fragility, or they will form some fibrovascular tissue and it contracts. Due to the traction and contraction of these fibrovascular tissues, what happens? Retina gets detached. So this is another complication because of those new vessels. Those new vessels are not good vessels. New is not always good. So these new vessels are abnormal vessels. Okay. So this new vessel is causing what? Vitreous hemorrhage. New vessel is causing what? Glaucoma. This abnormal new vessels causing retinal detachment, tractional retinal detachment.